Kenyans may have to seek medical services from private hospitals after the Kenya Medical Practitioners, Pharmacists and Dentists Union announced the commencement of a nationwide strike starting midnight today, March 13th of 2024. Addressing the media at the KMPDU offices, the Union Secretary General Davji Atella said the move is a result of failed dialogues with the Ministry of Health. Members of Parliament allied to Azimio Umoja One Kenya coalition, led by Minority Leader Opiyo Wandayi, have called for the resignation of Health Cabinet Secretary Nakhumicha. Kasichana Masha with the details.
We had promised that we are going to give a 7-day strike notice.
On March 6, 2024, the Kenya Medical Practitioners, Pharmacists and Dentists Union issued a strike notice demanding the deployment of at least 1,200 medical interns, among other grievances. After a series of unfruitful dialogue with the government, the union now maintains that its members will down their tools as of midnight, March 13, 2024.
When the clock ticks midnight, past 1 minute, I encourage all of you to join the liberation movement in a way that only you have shown us in the past the best way you can do it.
Addressing the media on Wednesday, the Union Secretary General Davji Atella urged medical doctors to discharge all admitted patients and do referrals for those in critical condition.
And we advise our doctors across the country to begin discharging patients and referring them, because the government has been on strike for the last 7 years, and tonight we will join them fully.
Members of Parliament allied to Azimio Umoja One Kenya coalition, led by Opiyo Wandayi, threw their weight behind the doctors' strike, saying their demands must be met.
We demand that the ministry shares with Kenyans its plans for the people to access emergency treatment, critical care, maternity care, neonatal care and trauma in the event that this strike takes off, as is very highly likely.
Speaking at Parliament buildings, the MPs demanded Health Cabinet Secretary Nakhumicha's resignation for allegedly failing to resolve the stalemate between doctors and the government.
If the Health Cabinet Secretary is not able to make the National Treasury release funds for a critical ministry like hers, then she has no option but to quit, really.
And National Treasury should also tell us, is it that you don't have money? Is it that you have not collected enough with all the taxes that you're charging Kenyans currently?
After the decision made by the union, this is what Kenyans had to say.
Pale barabarani kuna matatizo mengi sana, ajali za mara kwa mara. Wakiwa wataendelea kukoma na kusazana na serikali, sisi wananchi ndio tutaumia. So ni better wakiweza kuelewana, wakae pamoja waelewane.
Ningesihi serikali itimize mambo yenye imeahidi hawa madaktari.
Kasichana Masha, Prime Edition.